Let's talk about national health care. If we had a national health care system, it would save us $400 billion. It really would. Not to mention, a national health care system means that we're in control and democratically in charge of the system. There's no administration. There's no people telling you where to go or what to do. There's no death panels. Without national health care, many people go into bankruptcy. 58 people die each day because they're uninsured, and the healthcare system does nothing for them. Some people are thrown out of emergency rooms and sent to their death. Some people die in the parking lot. Let me tell you my story. I had a heart attack. Actually, I had 2 heart attacks. The first night I was rushed by ambulance to the emergency room. They said, "You just have a backache. There's nothing we can do about it. We'll give you an injection. Your backache will go away." It didn't. They sent me out of the hospital. The second night I went by ambulance. I had the backache again. They resubmitted me. They said, "Look, there's nothing we can do for you. We'll just give you these injections and you go home. Everything will be fine." The third night, I was in pain again. And the EMT saw me and said, "Why are you calling the ambulance so much? Your blood pressure has been up high. You should be checked for a heart attack or something. They shouldn't release you till your blood pressure is down." And she looked very concerned because she recognized me. She knew who I was, and she knew I was having a problem. The third night, they weren't kind to me at all. They said, "Look, you got a backache. There's nothing we can do for you. We need your bed. Get out of the emergency room. Vamoose." So I got thrown out of the emergency room, and I almost got sent to my death. The fourth time, I was in a store, and rather than call the ambulance, I had to drive myself. I had severe chest pain. I couldn't move much. I made it to my car, and I drove myself real fast to the emergency room. I was there waiting for a doctor to see me, and a cardiologist finally came in. He said, "Mr. Rhodes, you're having a heart attack." So they sent me to Pennsylvania by helicopter. I went to Penn Presbyterian Hospital, where I got great treatment. I also was taken care of financially right away. The social workers were concerned whether I could pay or not. I didn't have any bills, really. The helicopter fee was $16,500, but even that was taken care of. I was in good hands. But then I had a second heart attack. I went to the hospital. They deemed I was having a second heart attack, and I got shipped out to Cooper Hospital. I was taken care of at Cooper Hospital the first time, and I needed another procedure. When I went back, my finances weren't straight, and I didn't have the right health care. I saw the doctor, and I said, "It's nice to see a doctor." And he said, "You're seeing me, Mr. Rhodes, so it's not very nice." After he left, the nurse came in and said, "Look, your health care didn't come in. Get out of the hospital and put your gown on the bed and go home." I said, "But I need a procedure. My life needs to be saved." "We don't care. You don't have the money. You're not getting your procedure." So I went down to patient services and asked why I didn't get the care. And they said the money wasn't there for me. I said, "I thought the money was there for me. Otherwise, why did you even call me?" So they went through my personal finances and my bank records, and they even wanted to come to my house to see how I lived. They were going to throw me out. But I fixed things, and I got temporary assistance, and I got my procedure that day. If we're up to Cooper Hospital, I'd be dead right now. So you see, why shouldn't we have a system of national health care? The healthcare industry is vicious, it kills, and it will send you to your death. The national healthcare system would have saved me. I was getting bills, and I was even being called by collection agents for bills I haven't even gotten yet. It was a really nasty situation. Our healthcare industry is vicious and horrible. We need a national healthcare system like they have in Canada. So I will go to Washington and I will support Medicare for all. Thank you.